everything labor and delivery related was $59,710.
New moms all over social media are breaking down their incredibly expensive hospital bills after giving birth.
When we checked in, my husband joked with all the hospital staff that this would be the most expensive hotel stay of our lives, and he was not wrong.
So why is giving birth so expensive in the US? And given the Trump administration's anti-abortion, pro-natalist policies, is there anything on the table to make having a child more affordable? Let's start with a quick history lesson. The Pregnancy Discrimination Act of 1978 prohibits discrimination based on pregnancy, childbirth, or related medical conditions. Before that, legally, you could have been fired or had your benefits stripped because you were pregnant. Then by 1990, Medicaid was expanded to cover low-income pregnant women. Today, Medicaid covers more than 40% of all deliveries. The Congressional Budget Office, however, estimates that President Donald Trump's flagship budget law would reduce Medicaid spending by an estimated $911 billion over the next decade. When the Affordable Care Act was signed into law, maternity care was included as an essential health benefit. So, employer-based insurance plans were required to cap out-of-pocket spending on maternity services. About half of births in this country are covered by commercial insurance. But the cost for co-payments or deductibles before plan coverage begins can add up.
The most costly part of childbirth is associated with the hospitalizations.
Often, patients' insurance covers the bulk of the cost, but not always.
Often, the costs that insurers have to pay, that ultimately gets passed on to us as well.
If the cost goes up, the insurance companies increase the premiums, and often consumers pay for that increase. People who give birth see an average of nearly $19,000 in additional health costs, including almost $3,000 paid out of pocket. The U.S. fertility rate has been declining overall since the 1950s, hitting an all-time low in 2023. The pro-natalist movement, which believes that this falling birth rate will ultimately lead to economic demise and even the apocalypse, has been elevated by President Donald Trump. And Trump has voiced support for a $5,000 baby bonus, but $5,000 isn't always enough to cover the hospital bills that come after giving birth. In May, bipartisan legislation was introduced in Congress to require private insurance to fully cover childbirth. We'll see if that goes anywhere. But the root of the cost question starts well before going into labor.
We really need to focus on how do we decrease complications of childbirth that end up being costly, and how do we avoid additional hospitalizations.
We'll continue to follow this issue. For the latest health policy news, you can visit our site,